We're on site at McLaren Port Huron, and I'm speaking with cardiac catheterization and electrophysiology services nurse Linda Lockwood in regards to support services that are available for cardiac patients and their families here at McLaren. Linda, thanks so much for joining us today.
Thank you for having me.
So we all know how stressful it is when you have a loved one that's in for a heart attack or some type of cardiac problem. What if you have somebody in the emergency center, say, and they're being evaluated and possibly prepped for a procedure because of a heart attack? What are some of the steps that are taken to keep a family informed and to help them through this process?
So, of course, the whole coming in for a heart attack to the hospital is overwhelming for the family and the patient. So we just try to keep them informed of everything. We keep the family with the patient as long as we can until we take the patient into the cardiac catheterization lab. So during that procedure, we try to keep them updated with phone calls, making them aware. And then at the end of the procedure, the cardiologist will go out and talk to them and show them pictures and let them know that how everything came out.
Okay. And also, now I'm understanding that McLaren has a pretty comprehensive cardiac support group. Could you give us a little information in regards to that?
So it does. We started it in January of 2016. Mm-hmm. So we had a kickoff back in November just to let everybody know about it. And then, so we meet the third Wednesday of every month from 5:30 to 7 in the Duffy classroom at McLaren. And we just go over different topics, anything that any of the patients have brought to us that they're interested in, such as different diets, exercise. Mm-hmm. Dr. Sman has talked at the support group before, so it's very good.
And
lots
so
of topics.
This is also patient and family oriented.
That's correct.
Okay. And what actually initiated the cardiac support group?
So cardiac disease is a huge issue in our population. So we knew that people needed help, and then after they're discharged from the hospital, they don't always know who to turn to or if they have questions about their medications, anything at all. So that's what we started the cardiac support group for.
What are some of the biggest challenges for a cardiac patient and their family members or those taking care of them once they're released from the hospital and go home?
There's a lot of different challenges. It's trying to figure out the new normal to life because things will change. There'll be medications, there'll be different exercise routines, diet. So there's so many different changes. That's what we focus on.
If I was someone watching the program today, Linda, and thought that I could benefit from it or a loved one or someone I know could benefit from it, what is the best way to find out more information or get a hold of somebody in regards to this?
So the best information is gotten through Health Access, or you can go online to the McLaren website. Under classes and events, it also has the information.
Great. Well, thank you so much for joining us today, and thanks for all this great information.
All right. Thank you.
This is Sarah Tate reporting for McLaren Port Huron today's health program.
Thank you, Sarah and Linda, for sharing that information with our viewers. And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.